Hello and welcome to your Health Matters Let's Talk. Now, your Health Matters Let's Talk is a monthly discussion program focusing on priority health issues affecting us in our day-to-day lives. On this episode, we are discussing diarrhea. And now, help me welcome my guests on the program. Dr. Clarence Chiluba is the head clinical care and consultant physician at the Levi Mwanawasa General Hospital. Welcome to your Health Matters Let's Talk.
Thank you, Creo.
And just next to Dr. Chiluba is Dr. Roma Chilengi. Thank you again to see you on your Health Matters Let's Talk. He is from the Center for Infectious Disease Research in Zambia. Welcome to the program.
Thank you.
And now, before we go straight into the discussion, here's a clip from the community on how they're dealing with issues surrounding diarrhea. Watch this.
And 3 months, 2 weeks.
3 months, 2 weeks. Alonka?
Alonka.
Mwachilanda tuwafiansha kwete?
Diarrhea.
Nga chakuba tishashtika ngefi chiri kumwana oyu nadwala. Tukonka nyepo kumupere bere ribiri. Tule umfana nini? Pantu iri nebere ri. Techaka no kwata maka. Kutare polomelero makana tashani? Na kwata. Pantu amenshi emoyari. Ifyakulya fyonse emofiri. Ubusuma bwebere. Pako no kupekanya.
Ukonsha chikankala chirafirisha abana kukula bwino. Pantu ngata posere kwa mano mukonsha mwana taba yothi bwino. Ero narisa mbo kwamba pa zero konsho mwana ukwabure chakulya ichiri chonse. Pantunga mwabapera ichakulya ichiri chonse nangwa amenshi balalwala diarrhea. Pantu abana nga taule monsha sana balalwala tumalwele twapusana didebele lila chingirira amalwela yengi mwana shamwene po problem ili yonse nale musunga fe bwino na under 5 yako yali fe bwino.
Before we received the rotavirus vaccine, the bed occupants of the babies suffering from diarrhea in the ward was quite high. But as at today, we have only 6 babies in the ward suffering from diarrhea. And we can testify to you that it has really helped us that when they come, in whatever form or severity of the condition, they are recovering faster than they used to do a long time ago before we received this vaccine, more especially in cow.
Now let's go straight into the discussion. I'll start with Dr. Chilengi. What is diarrhea?
Diarrhea is a condition in which a person who is unwell is passing stools that are more loose than normal and passing them at a frequency of 3 or more in a period of 24 hours.
Dr. Chiluba, how serious is diarrhea in children aged between 0 to 2 years?
When you look at the cause of death in children under 5 years and even under 2 years, you get that 6% of the causes of death in children is actually arising from diarrhea. And it's the 3rd commonest cause of death in our country, just next to pneumonia and malaria.
So what are the problems associated with, or the dangers associated with diarrhea?
Diarrhea is such a common problem that unfortunately we get to accept it as part of normal life. It's not supposed to be normal life. It is a problem, and when a child, particularly the very young children, when they have diarrhea, what it means is basically they are losing more fluid than they should. And that means that a child is passing out more than they are able to retain. And in the process of passing out that fluid, they are also passing off what we call electrolytes and other important elements that help the body function properly. And that results in a whole complex set of problems that follows the health of a child. So diarrhea will typically cause a child to be initially very irritable, and they will have difficulties trying to eat and feed as they normally should. And if it progresses, then they begin to get into a state we call dehydration. In fact, it is particularly worse when they are having both diarrhea and vomiting, because the rate at which they are losing these electrolytes or these minerals that are normally in the body is increased, and therefore they deteriorate faster. So diarrhea, to get back to your question, is a very, very big problem.
What are the health impacts? Could you just explain on these complex issues and the complications that can come with this disease?
The health impact of diarrhea, you heard from Dr. Chiluba saying you have children spending a lot of time having diarrhea. It's not a normal thing. That means instead of a child growing properly, their body is busy fighting back the disease. So the developmental process of a child will not be that good. If you bring it into the household, you find mommy will not work when the child is sick. If they are admitted in the hospital, that means the income and livelihood in the house will be affected, not only from lack of working, but also from the fact that they have to spend money in that regard. From the health system perspective, it means our wards in the hospitals and clinics, they are overloaded with these children. So that stretches also the health system. The healthcare provider has to deal with so many children, and so the consequences of diarrhea and the health impacts are many.
So how can diarrhea be prevented?
There are so many actually simple ways. First, it has to start with our personal hygiene. So you have to look at the personal hygiene, just simple hand washing. As you go to the toilet, you come out, or as you're about to touch the kid, you are doing some other things. I think that can easily be implemented. Then we have to provide clean and safe drinking water. So those are issues where you have to do the boiling part of the water for it to be safe, or otherwise you have to use chlorine and make that water safe for the children. And looking at the feeds that we are giving our people, we have to cook it properly or wash it properly if you are giving them raw. These children who are being affected, 85% of the cause of diarrhea in this age range would be from the rotavirus. So what we can do is to give them a vaccine for the virus that is the commonest cause. We are also giving health education and also giving our people chlorine.
I think we've got to get to a point where we understand that our health is in our hands at the household level. So prevention is always better than cure. It's always cheaper than cure. It's more convenient than cure. So if we can take basic measures, it will help us prevent diarrhea, particularly for the young child. Because the young child's body is not yet strong, so a little infection can tip them into complication. Now, on the question of the newborn baby, I believe you've seen messages, the ministry emphasizing the fact that when a baby is born, let us exclusively breastfeed, because that is the best food for the newborn. And you might be interested to note that the content of that milk, especially the early milk that is coming from a new mother's breast, adjusts according to the needs of the baby. And most importantly, when a child has diarrhea, let's go to the health facility so that appropriate treatment can be offered. Most times, children who die from diarrhea, they die because intervention is done late. So early presentation to the facility is another important thing. You will find many of our children who come very sick. They are brought having taken these roots, having taken mango leaves. We've heard of situations where children are even given these tujili beers. So there are certain habits in our communities that really work against the health of our children.
I'm sure mothers would say, what can I do before I even reach the health facility?
When your child has diarrhea, understand that they are losing fluid, therefore replace the fluid. The best fluid for replacing is your oral rehydration salts. That fluid is designed with concentration of the various minerals and salts that will efficiently replace what a child is losing. Zinc is a tablet that is very cheap and now widely available, is good treatment for diarrhea. It is available over the counter. You don't need a prescription for it. And mothers, we want them to know, when my child has diarrhea, I can give ORS, I can give zinc, and I continue to breastfeed as I rehydrate and then go seek health care. Diarrhea is a broad sort of problem. It's caused by many different organisms. So in the current scope of medical interventions we have in the country, we have rotavirus vaccine, which will prevent diarrhea caused by this single agent. It doesn't remove the other causes.
Does it mean once vaccinated, no more diarrhea?
No, like we are talking about the virus, we are just targeting the virus because it's the commonest cause in this age that we are looking at. And so the other percentage, like the 15%, would be caused by other bacteria. You obviously will reduce the number of diarrheas that you are going to have. Especially from rotavirus, we might eliminate it. But for the others, then you might be exposed, especially if you are, because it's mostly fecal oral. And if the food is contaminated with the other bacteria, then you're going to have it.
Thank you so much, Dr. Chiluba and Dr. Chilengi, for sharing your experiences with us on this subject of diarrhea. It is now time for questions from our audience. Audience, are you ready with your questions? Yes. Let me see the hands of those who have questions. I'm very thankful. This audience is very, very lively today. We'll start with the lady in front here, please.
Thank you very much. Thank you very much. Doctor, I'd like to find out, because we have a lot of children being affected by what is called chibele. So what is chibele? And then medically or health-wise, how can these children be helped?
Thank you. Would you like to take that question?
Yeah, I think it is a myth where people usually talk about chibele as a cause of death in our children. Breastfeeding, just milk coming from the mother, is the best so far. And the number of benefits that you receive, the nutrition part, then it also has some protective. Your immunity is not that well developed as a kid, so it also offers that immunity to you. Then also how it protects again from diarrheal disease is that the same breast milk has got some bacteria which are beneficial to your intestine. So the mother will give you about 600 species of those bacteria that will go and sit in your intestine, that will go and sit in these children's intestine. Then protect them from having this disease.
If I may chip in, Cleon, for those who may not understand it, it is a belief basically which is widely embraced in our culture, and there are various versions of it. You know, there are versions around if you breastfeed in public, you know, you might harm your child. If you are breastfeeding at the same time with another mother who is also breastfeeding and they have a particular charm, then your baby will be harmed and your baby can get sick, they can get diarrhea, or they can even die. To us public health officials, this is a major hindrance to the message of breastfeeding.
Yes, but then fortunately that myth has been busted. You can expose your breasts in public anywhere, just ensure that...
You can call us myth busters in
yes.
this case.
I think they deserve a clap. Let's get the next question. Thank you. Let's pick the lady at the back.
Doctors mentioned about that chlorine is very important in water treatment. Now, my question is, how affordable and accessible is this? And how safe is chlorine? Is it the best option for water treatment?
Talking about the cost, it's very difficult for me to say the common man, every common man would afford, because it depends on the pocket, the amount of money that they have in their pocket. People who cannot afford that one kwacha, they also can go to a local clinic or any health facility and they will be given some chlorine. Chlorine is very safe. And actually what you need is a minimal quantity for you to make your drinking water clean and safe. reducing on, and what we mean by that is just to kill the bacteria that might lead to you having diarrheal disease. And the amount that you're going to put in a 20 liter, just the lid top. But it's the safest, it's cheap to use, and it does the killing of the bacteria within the shortest possible time. So chlorine is very safe for humans.
Yes, the gentleman at the back. Please go ahead with your question.
Thank you so much. Teething normally in a child is accompanied by diarrhea. So what I want to find out from you, Doc, is there anything a mother or a parent can do to either alleviate or stop it completely?
That issue of a child teething and diarrhea coming up, it's a very, very common occurrence. And it is actually very obvious to anyone who's had a baby or lived close to a baby when they are beginning to teeth, which is round about 6-7 months. They also begin to get diarrhea. This is the time a child is now beginning to sit and to crawl, and you know what else they are beginning to do? Anything they touch, they will put right in the mouth and they want to bite. And before these teeth bud in the gums, as they are penetrating the gums to come out, they cause a sensation. It's like itching, and the child always wants to scratch. And this is the main reason why they will find anything they pick and it goes straight there, and they will want to keep it there, and they'll be biting on it. And in that process, as you can imagine, because the child now is being put on the floor, is being put down because they're able to sit, some of them are able to crawl, they pick everything they can find. So is there anything a mother can do to avoid that? I think there are several things a mother can do. Firstly is to understand that this is what is happening to my child, and so make sure that the environment around which your child is doesn't have too many things that a child will pick. The child will be picking everything on the ground, and all the dirt will be going there. It is no wonder before the teeth show up, the child is having diarrhea.
The next question, please. Thank you so much for the hands. The gentleman here.
Thank you so much. It is considered that children's feces do not cause diarrhea. How true is this statement? Thank you.
Wow, it looks like we have to number the myths.
Yeah. Exactly.
But earlier you heard us alluding to a concept we call fecal-oral transmission. Yes. A lot of infectious diseases, especially that affect the gut, the digestive system, they get transmitted actually from contaminated stools back to the mouth. So a child, when they have an infection, they will transmit that infection. And the famous rotavirus that my colleague talked about earlier is very efficiently transmitted through the oral fecal route. And that means when a baby is infected with it, they will have diarrhea and they will be shedding a lot of these viruses. And that myth has it that many of our mothers believe a child's stool is fine. When they change the nappy, what do? They just wipe on the chitenge. Mm-hmm. They go make bread and put blue band or whatever and give to the older siblings, and that's how these infections get transmitted. And they go touch the utensils now. And the coming in of diapers, it's right there, right? So if you are going to change your diaper and you are touching things, you wash your hands with soap. That's how you break the transmission. If you don't, you go touch other utensils. Rotavirus, by the way, will survive on this surface. If it's contaminated on my hands and I touch it, it will survive. Somebody else will come and touch it and put in the mouth. Remember the way we behave as Africans. Yes. We like to shake hands all the time, and after shaking hands, we are eating vitumbuas, right? That's a very efficient mechanism for transmitting infections that are passed on from person to person.
Yes, so it goes back to hygiene for mothers.
Yeah, basically, like you have put it, Doc, I think we have to look at the hygiene. So it's not right to say fecal matter for children or for our infants is safe and clean. No. If it's infected, then you are going to get the infection. Anyone who's going to get in touch with that and they don't have the immunity, then they will definitely develop some infection, diarrhea resulting as well.
The gentleman at the back, thank you so much. Yes, please go ahead with your question.
Thank you so much. I hear bottle feeding causes diarrhea. Is this true? Thank you.
The bottle comes with a few complications. The number one problem with bottle feeds is that it's not breast milk. I think that's clear, right? But number two, it costs quite a bit of money, that formula. If you get a tin of it and you actually give a healthy baby at the recommended rates, it won't last 3 days. It goes. And an average mother cannot afford. An average mother can really not afford to do away with breast milk and stick to that formula with all its frailties. But then the complications are many. Added to that is the fact that you don't have to work very hard to keep the breast sterile. You simply wash and clean with soap, that's all, and water. Whereas the bottle, because you are keeping liquids there and you are keeping milky products, and microorganisms thrive in those kind of environments, or let me say germs. Okay? So if you are going to feed your baby with a bottle, you also take the job of making sure that the bottle is sterile. Now, to be sterile, it's not an easy thing because we don't see bacteria. They are microscopic organisms, and so the rules are around you have to boil, you have to keep in a safe. So many of the mothers who fancy bottle feeding cannot actually cope with the cost and the requirements of keeping that bottle sterile. Many of them don't even have a source of safe water. So if they are going to make the milk itself with water which is already contaminated, you will therefore get conclusions that these bottles cause diarrhea.
Thank you. Next question, please.
The availability of water in most of our societies is a major problem. The question that I have for you, Doc, is what do parents do to avail safe drinking water to their children?
It is difficult to have very good hygiene in the absence of safe water. What should a mother do when there isn't safe drinking water? There are a number of measures. I think we were talking earlier about chlorine, where people traditionally get water maybe from the river or from wells that have visible particles in them. There are filters that can be bought, water filters, and some of them are very, very good. Now, the question of affordability there might come in. But I think that if you can't get your chlorine, if you can't get your filter, at least you can get your firewood and your pot. And if you're able to boil water, what happens is that that process of boiling water gets the temperature high enough to 100 degrees. Water boils at 100 degrees. There's no living organism that will survive that. So as long as you get the water boiled, you cool it down, and you clean your containers where you are keeping it, it will reasonably be safe.
Well, Dr. Chilengi, I'd like to thank you so much for making an appearance on Your Health Matters Let's Talk. And Dr. Chiluba, thank you so much as well for sharing your experiences with us. To the audience, thank you so much for your participation. Very thought-provoking questions you did ask there. Thank you so much again. And to the audience at home, our viewers, remember you can participate or interact with us, ask us any questions concerning the topics that we discuss on this program. On our website, www.facebook.com/MOH Zambia. This is Your Health Matters. Let's talk. Goodbye.